Welcome, everyone. My name is DJ Wells. I'm the Communications Director for Mensah Medical and the Executive Director of the Mensah Research Institute. Thank you for joining us today. This is our weekly conversation, Coping with COVID, where we talk about the various things that we can do, that we are doing to deal with the craziness that this pandemic has thrust upon us over these last several months. Today, we've got a very special presentation for you, and thank you for joining us a little bit earlier than we're normally on the air, but we've got a special presentation, and we had to come to you a little bit earlier today because our guests are coming to us from overseas, and they've been gracious enough to stay up late and be with us this evening. And so we want to welcome our guests from across the pond, as it were, Dr. Joanne Hands and Sheikha Majda al Sabah. I hope I said that correctly. She's joining Dr. Mensah and Maryam Tafreshi, who's been with us several times before. And we're going to have a conversation about some of the global implications of this pandemic, what's going on all around the world and how people are dealing with this and you've heard me use this term before, this new normal that is the COVID-19 pandemic. And so, as we always do, we encourage you to be interactive. And so if you have questions for any of our panelists, for Dr. Mensah, for any of our panelists, please do use the Q&A tab. It should be at the bottom of your screen if you're on a computer, maybe at the top of your screen if you're on an iPhone or a tablet. But click on Q&A, type in your question. We're going to let Dr. Mensah and our panelists go for probably about 45, 50 minutes or so, have a conversation. And then once we start getting some questions in from you towards the end of our broadcast, I'll go ahead and come back on and share those questions with our panelists. So without any further ado, I'm going to hand this off to Dr. Mensah, and let's all enjoy this conversation about this global phenomenon that is COVID-19. Dr. Mensah, take it away.
Thank you, Mr. Wells, and I want to thank our wonderful and distinguished guests. Folks, this is a real treat. It's a real honor to be able to share information, to be able to share wisdom, and to be able to share some understanding with members around the world, members of the human condition, and how different people in different locations, different countries are responding and reacting to this. And you've heard us in the past talk about international psychology. And we have the president of the Middle Eastern Psychological Association with us, Dr. Hands. And Dr. Hands, we are so grateful that you're taking this time to be with us and the special guest that you're bringing along. And I certainly by no means will be forgetting future doctoral candidate, Maryam Tafreshi, who has really serviced us extremely well in coordinating all these things, all these programs, as our special programs coordinator. And without Maryam, none of this would be possible. So I want to give a big shout out to Maryam. Thank you so much. And Maryam, you're going to be participating, and Maryam is going to be actually kind of driving and coordinating much of this conversation. So I'm going to limit my own personal verbosity, unlike most of the time. And I'd like Maryam to go ahead and take it away. Dr. Hands and Sheikha, thank you so much for coming today.
Our pleasure.
Thank you so much, Dr. Mensah and DJ, for your kind introduction. It's a pleasure to have been meeting you and be working with you, for several years for the, I think, global goal we have for the betterness of the mental and physical health of people, bringing in the research that already exists that maybe it's not being used, and doing the collaborative work with psychologists. I had a pleasure to meet Dr. Hands at the first MEPA conference, actually, and then had the chance to present actually with you, Dr. Mensah, at MEPA conference, the second one. And also Sheikha Majda, I had a pleasure to meet her at one of the conferences, and I really look forward for your insights today. So Dr. Mensah, this is my question. Since you do the clinical work from the orthomolecular side on mental health, and Dr. Hands does the clinical psychology work on mental health. Would you like to initiate that conversation first, and then maybe as an advocate for mental, physical health, and then I start a conversation with Sheikha Majda, and we go from there?
Absolutely, absolutely. First of all, I want to have Dr. Hands come on board so everyone can see her and gain some wisdom and understanding. Dr. Hands, the work you do is not only critical, it's revolutionary. In your part of the world, it's not something that is discussed quite so easily, the idea of mental health and mental challenges. Can you share some of this with us? And then, of course, we'll let you guide us in the appropriate directions accordingly.
Yes, actually, I don't know if it's that big as you mentioned. One thing for sure is that every single day in this career path that I'm actually living is a true passion. Everything that I've done so far is coming from my deep heart. Okay, so I don't see it as a profession, as a career, as something so intense, as something that is my passion. I came to Kuwait about 15 years ago, and to be honest with you, it was very, very limited, the talk about mental health. It was still extremely high, covered by a big high stigma, and it was more probably targeting the people that had severe cases of mental health, like schizophrenia, bipolar, very severe, and again, somehow isolated, I would say, okay? It was not until we started the talk and started making more noise when actually MIPA was established. And I came in, actually when I became president of MIPA, there was like less than 10 members in the association. And now 5 years later, MIPA is internationally recognized. We signed an MOU with APA, and I mean, it's recognized all over the world. I'm part of, MIPA is part of 70 of the international psychological associations all over the world. So I'm very proud for that. But I have to say that I cannot do this alone. And actually that's why I think Sheikha Majda is here tonight with us, because in order to enter, I would say to enter this population in the Middle East, it takes more than just a professional coming in and talking about the theory, the evidence, the research, the profession itself. It takes a lot more, and I've realized it all these years. It takes the community to actually believe in you, to believe in what they're going through, and to then say, okay, so there is something called psychology and it's supposed to help. And you know, so that's how we have done, and I'm proud of saying that MIPA, since I became the president, turned the perspective of what every other conference in the world does, which is psychological conferences are dedicated and targeting professionals in the field. When I became the president, that I started the first international conference, I said, no, all of us are mental health providers, are professionals, we already are in. We need to actually reach out to our consumers, to the community, and educate them. And so that's how we started the communication and the collaboration with the community, with those who are actually going through it, experience it themselves. And they are the ones coming out saying, there's no shame, okay? There's no stigma behind this. Every single family in the world has gone through something at some point, from addictions to eating disorders to depression, anxiety, every single family, you know? So why we have to attach that stigma behind this field? So that's how now psychology is starting to get a stronger, I would say a stronger perception or recognition in this side of the region. And I actually speak mostly in the Gulf, mostly, okay? So yeah, I think, I don't know if that answered your question, but it has been a journey. This is just the beginning of it. We still have a lot of work to do, especially with standardizing the practice of it. Right now in Kuwait, everyone that just has a bachelor's degree in psychology can open a clinic and start practicing. We don't have licensing boards, so we want to standardize those guidelines and the field in general in order to be able to provide the quality of services that the consumers deserve.
I think you're too humble, Dr. Hands. People here don't have, in many respects, often don't have the depth of understanding at what a revolutionary concept this is to change culture, cultural dynamics in the Middle East. Any other part of the world as well, but certainly the Middle East specifically, where you've got these very strong stigmas in the past against mental health. And to acknowledge that this exists and to be a pioneer in the field, that really is huge. Much congratulations to you, and you're extremely humble, but it is far more powerful than just a simple thing where here in the United States, for example, we just routinely say, there are even jokes on television about how many different therapists some people have in certain comedy routines, where they just casually say, oh, today I'm starting my Zoloft, I'm starting my Paxil, and just this wide open conversation around mental health or mental illness, so to speak. And that doesn't happen around the globe. It does not happen, let alone in some places it's not allowed. That conversation is literally not allowed. So there's been a big change, and that's why we're so proud and so happy to have you on board with us. Thank you.
I wanted to add something. Dr. Hands, I also wanted to mention not only your work as a clinical psychologist and everything that you're doing as a president of Middle Eastern Psychology Association, for example, breaking the stigmas culturally for people so you can help enhance with your team the health of people, which is huge. But also I would like to add your education in international psychology and having a PhD doctorate degree has given you such a, and I believe this should be first a characteristic, and then you have gotten the knowledge, studying it. This has given you such an open mind and flexibility. And I would like to say this. I remember when I wanted to make the multidisciplinary panel and bring Dr. Mensah from US, bring the head of the immunologist, Dr. Khalid, in Dubai, and also another of our speakers from Germany. We went through, you were very open, the idea was very new. It wasn't something that psychologists use, the orthomolecular cell level treatment for mental health, nutrient therapy for mental health, but you were open. So I put the proposal, you read it, and it went to the scientific community. The great thing was the scientific community, we had members from the international psychology community. So we had this shared knowledge of how to talk and be open to newness. And we went through several conversations back and forth. And I remember you said, Maryam, can you explain this? Yes, the scientific community wants to know this. How is this, helpful for mental health? So this was huge. I knew that once I bring the science for you, knowing what you have studied and who you are and the openness, we're going to move forward. And we did. And I'm grateful for that. And I think people within the region, having you as the president of the Middle Eastern Psychology Association, what you are doing in Kuwait, it's a blessing. You are a blessing for the region. And I am personally very grateful to and have a pleasure to work with you, throughout these years.
Thank you. I just want to make a comment about this, Maryam. Yes, during that time, we have to, and this is why I think I pushed for that presentation to happen and to take place, because we cannot go and take the psychology as a traditional psychology that we normally have. We need to be more creative, think outside the box and use any kind of venues that we can access, in order to send the right message, so yes, of course it has to be scientifically based and research based, so we keep the credibility, but we have to be creative. It's an art,
Yes, yes.
and so yeah, we have to approach the people in the community.
As you said, it has to be scientific, and you wanted the science. And there's a post I put a few years ago on LinkedIn, and actually a few months ago I put it on Instagram. Duke Global Health has mentioned per year there's over 1 million research coming out. But if there are 10 people, even from maybe really even policymakers are interested to read multidisciplinary work. So this is the issue. For example, the research that, let's say, that either Dr. Mensah or clinicians like Dr. Mensah are interested to conduct or read, not necessarily as being read. There's a tendency to do the same thing. And if we ask the same question over and over, we get the same result. So we can't, then we're not open. So this is, I'm seeing hope with the openness you have to, and interest, to see the new research, other ways of assisting mental health. Let's say counseling, yes, if there's an emergency, maybe we do medication, but nutrient therapy. And also seeing Sheikha Majda as a very influential person in the region. And I'm very excited actually to hear her talk today about her journey, what happened that she became the entrepreneur she did, the influence she has, the people that know her and listen to her. I think she's a wonderful and great source to bring knowledge to people, to bring awareness to people. And I'm very excited actually for Sheikha Majda to also hear how Dr. Mensah also does this. So Sheikha Majda, would you like to talk about your journey as an entrepreneur? What happened that you became interested in what you did? Whether it was a personal journey, was it the challenges or not, or was it an interest? Please, if you can share that with us.
Sure. I would like to give you a brief about my life. My life, as anyone on the earth of this on the face of this planet has problems, and we all get into obstacles on a daily basis. So I started as like a mother who had children in a very young age. I didn't continue studying because I was really busy with my kids. And then the kids grew older and I had plenty of time in my hands. So I started my little business, which I gave it all my heart and soul. And it became a success overnight. I started to have the social media as a marketing tool for my business, but it derailed and it became it became my lifestyle, showing my lifestyle as someone who is from Kuwait, her social life, all displayed for people to, and my aim is let me show people that you can do everything and there are no limits. And then I was really pushing myself really hard to work hard. And my father had a stroke 3 years ago, and thankfully he's okay now. But the amount of stress had me frustrated to a point where I cannot leave my bed, I cannot wash my hair. It was a disaster. I'm a very social person, and overnight I just became like a vegetable on the sofa. So thankfully I have a very loving, considerate family who suggested that I should go visit a psychiatrist, and I did. And she told me that and it is mild, but we have to take action. So immediately I was on tablets. So I went on medication full force because I don't want to be in this situation ever. It's very hard. I don't know if I could explain it right, but I don't want anyone to have this feeling, not even for a minute. So I withdrew from my social media platforms, all of them. I just disappeared for 3 months in a row. And during this time, that was the time when I realized that there is a very big stigma and that we need to do something about it. Because whenever I'm a very open person and I like to share my story with others, and whenever I open up to people, they would just tell me, no. Who's going to marry your daughters if they learned that you are on meds? Imagine the mindset of people around me. And I am talking about people who are, graduating from Harvard, or, they are very well educated people. And I was like, you know what? I called my sister. She's my partner in the business. And she said, and I told her, listen, we have been searching for a while for a CSR campaign for our company. I have it. It's going to be for mental health. And she was like, why is that? Because you suffered? I said, not only I suffered, it's because there is a lot of stigma that we need to challenge. So we started, and then everything just escalated, because one of the big reasons that black hole that I was in is planning for this initiative, for me to have a purpose, to challenge myself every day, to wake up and go do something for people, for humanity. If I listened to myself talking, I would never recognize myself, because back then I wasn't that person. So depression is a blessing. It opened my eyes to things that I never thought of. I became more human, and I became more considerate, and now it became my life, and it's so beautiful, and I have never ever been happier because of this initiative, because I'm helping people.
Thank you, Sheikha Majda. I would like to also mention, because some people might not know what the term Sheikha means. So you're a princess in Kuwait. So that, I'm interested to know how much of a bigger pressure, because of your fame or being well known, how was that for you? If you can explain that for us. But before you do that, I want to applaud you, because about 2 months ago, we had a online talk with Dr. Mensah about resiliency. And I brought in some concept of positive psychology, and one was gratitude, or trying to find the good and the bad, which I believe, and there's a saying, at least I'm from Iran, so in Farsi we have, and most probably in your country you have it, there's a blessing in the hardness. There's something good in that maybe God or the bigger force has brought for you, if you can try to find it. And I can see that this is one of the ways that you try to lift yourself up and be gratitude for the pain that you received, and also taking it further and being a big force of giving to humanity the best that you can and bringing awareness. So can you also then please explain, considering how well known in the region you were, how was the challenge, for your family, in that sense? Or maybe even for other people who maybe were related to you, family or non-family, would you hear things from them, and that this is a shame, or making you shameful or guilty about it?
Yes. Well, my close family are very supportive, and they know. Listen, shown on a daily basis for people as royal is not considered normal. No, that alone is something that I had, people were not pleased to see the royal, showcasing her life every day, and in a very casual clothes. This is something that they are not accustomed to. And then, but I was fine with this. My family were fine with it. So I was like, I want to do whatever I want to do. But then came the mental, disorder. And then when I first went out after 3 months of disappearing, and suddenly I was like, okay, I'm back, and I had depression, and I'm still having depression, and I'm still on medication, and I'm not ashamed to tell you all about it. That day, you have no idea what happened. Everyone was calling me. Some of them are really, telling me positive things, applauding and whatever. And some of them are like, why are you doing this? Because they don't understand. But the people who are speculating the thing are now, supportive. So people change, Yeah. This is about the being in my position. So I think it's fine. People love it now. People can, they share with me when they go and you visit their psychiatrist. They just take a picture or a selfie with the psychiatrist and send it. And that was something that was a big no-no beforehand, So yeah, I guess, people change, every single day. Whenever you give them those little messages, it goes into their subconscious, and they come up with new values that they can, live with.
Sheikha Majda, this is amazing, and thank you so much for sharing this, because as an international psychology PhD candidate, and also my dissertation is on empowerment of women within the region of Middle East and its relationship to mental, physical health and satisfaction of life, and its connection to attitudes, social and cultural attitudes at a family level, social level, larger context, and policies that affect us. I can only say you're one courageous, empowered woman to go against the norm, that was so very necessary for your people and people within the region. You enabled, you became the leader to use this time for people to go behind you who were scared and ashamed to go help themselves. And I'm just grateful for that, to see people like you, women like you, empowered women like you, are leading the way. So thank you so much for your courage.
Thank you so much. I'm really humbled. Thank you. Well, I don't know what to say, but you know what? Now I'm having a tribe with me, and I was like a single voice. And then now I have a lot of people, and we have to consider mentioning all the initiatives, all the campaigns. They are trying so hard, but the problem was back then is they do not have. They are all like physicians, and very from a scientific point of view. But me as a person who did not. I do not even have a degree, but I am speaking to people from their own perspective. So I think this is the thing that, made them realize that this is something, normal, that everyone can have it.
Dr. Mensah, I'm going to let you, please, if you want to add something, because I know there's so much insight you have that you can connect your knowledge with what's Sheikha Majda has mentioned here.
Oh, thank you, Maryam. I think that what we're seeing is now the opportunity for a lot of different therapies to come into play. As the three of you have really sort of talked about keeping an open mind and looking outside of the box, as usual, in order to get to a new result, get to a new place, one that benefits the entire people, as opposed to constantly looking in the same area and thinking you're going to get different results. You're not going to do that. And Maryam, you've been exposed to a number of individuals and programs and processes, from immune health to microbiology to orthomolecular, that all have their place and all have a role. What is exciting to see is a member of the royal family who is such a distinguished individual for the entire region, the entire culture, now opening up to allow or to help bring these different modalities into play to help people who otherwise would be excluded from that. And perhaps even with the idea of open discussions around mental health, would be relegated to medications, pharmaceuticals only, and these types of things, because it seems as though that's the only answer, when it truly is not. So truly, the three of you have opened up an exceptional world to the people in the Middle East and all over the world, as a matter of fact, through MIPA's international connections. So what I want to ask is now, as the three of you really pioneers, what do you see relative to now the types of conditions that are coming forth? So we see you on the other side of the globe, and we see us here and individuals in different places as well. What do we see in terms of the prevalence of anxiety or depression disorders? What are the major types of conditions that people are coming to you to discuss? And that's Dr. Hands, and that's Sheikha, and Maryam, you as well. This is a way that we kind of see that no matter where you are as a human being, we're not that much different in terms of the kinds of responses that our systems have to stress of any type. So Dr. Hands, if you would like to start us off, can you share with us what are the most frequent or the most common conditions that you're now seeing? And then Sheikha, you can comment after that, and then Maryam.
Absolutely. I would say that's, without even thinking about it twice, I would say anxiety disorders. Okay, so to me, in my clinic, I would say about 80% of the cases that I see are related to anxiety. And of course, with that, all the tree of things that come, including eating disorders. So eating disorders it's also it's all triggered by an anxiety of being skinny or not gaining weight or being in a certain body shape. We have, I would say, generalized anxiety. I would say one of the most common here is social anxiety. And I have my own, I would say this is me, don't repeat that, this is just me, Joanne, saying it. My own kind of theory of why this is happening, and especially married to a Kuwaiti, marrying into this society. I know a little bit of how things kind of work in here, and I'm understanding why the high levels of anxiety, and it's because of the pressure, you know, and that's why Sheikha Majda is a very good example of it, because I would say, and keep in mind, and as we all know, that the best friend of anxiety is depression, right? So 99% of the cases that suffer from anxiety suffer from depression as well, because who's going to be happy when they're always worrying, concerned, and you know, so the pressure that society has on the individual is extremely heavy. We live in what we call a collectivistic society, collectivistic culture. And so what happens to one individual impacts the entire circle of that individual. So whatever happens to me is like Sheikha said, if you open and you say that you're taking medication and that you have a depression, your daughters might not get married, your husband will be ashamed, your parents are, you know, so is the entire community being affected by the behavior or the condition of one person. So can you imagine the load on somebody's shoulder? So yeah, without a doubt, I would say anxiety disorders are the number one. Sometimes it's almost as if you are not allowed to be you, to be who you want to be, to dress the way you want to be, because there's certain expectations of you. You cannot do this, you cannot say that, you cannot go there, you can dance like this, or if you can dance. But yeah, so there's so many things that you're no, ape, haram, so it's a sin, it's not allowed. So you know, people can it's like asphyxiated. So how mental health can actually play a role in an individual's life when we live with that pressure. So I would say that, and I know that you are kind of smoothing in the topic of COVID. I say this is what we are actually visualizing right now and experiencing right now. I liked one statement that Sheikha Majda said when she mentioned how now all of those who actually perhaps maybe express some resistance before are now joining the team, are part of the tribe behind her, and that people change. It is unbelievable. It's amazing to see how, well, in Kuwait, we started with the curfew and lockdown, I would say around mid-March, when it started with the partial curfew and then the full lockdown. Until now, we still have from 8 p.m. A curfew. And it is amazing to see how people adapt. At the beginning, you could see the resistance. Actually, in my therapy work, I've seen both sides. So we had the people that said, oh, this is great. I don't have to put up with anybody. Society, commitments, expectations. We had the other crowd that says, oh my God, I remember I had a client who said to me, Joanne, we can't, they're closing the airports. We can't travel. Imagine. And I said, oh my God, you had a trip coming? She said, no, but they're closing the airport. And then I said, okay, so you did not have any, upcoming trip, no plans of traveling. Why would you be impacted with the fact that, well, I just feel like I'm locked in here? You know, it was just the perspective of like, just perceiving the fact that I'm locked, that is already affecting me, when in reality it was not affecting her. But how to see now over the course of these months the change. We are okay with it. We are accommodating. We know that we can only go do some shopping in the grocery stores for certain hours. We know that we have to get a pass to go out to certain places. So we're making the best of what we can. And that's the beauty of, I would say, the beauty of psychology, that we study that, how human beings can adapt. And so to me, it's fascinating to see how my clients have been able to go over their own fears and their own resistance, So yeah, I think that I hope I answered your question.
You
it's
did.
A bit long, but
no, not at all. I'm actually very surprised, quite honestly, about eating disorders. And while we really shouldn't be, with the preface that I gave, which is that in the global community, we're all human beings subject to the same stressors, and we should see the similar manifestations. Yes, 100% anxiety and depression are two of the most common and prevalent conditions. But I'd like you to talk a little bit about eating disorders in Kuwait and in the Middle East.
Sure, and even maybe from another perspective, Sheikha Majda, that can help me with that.
Please, yeah.
I actually used to work in the States in an inpatient institution for eating disorders. And so when I came to Kuwait, it was one of those topics that really caught my attention. You would see throughout the whole scheme, like everything from obesity to completely underweight. I mean, amazingly underweight. But again, I see it as a combination of cultural factors. Okay, so I'm going to speak in this case just purely for Kuwait. The society runs around gathering, and there's always, no matter what meeting you go to, or visiting a person that is sick, or visiting a person that just gave birth, there's always you're surrounded by food. If there's no food, if there's no chocolates, if there are no sweets, you are a very bad host, or it's a disaster, right? So the entire culture, if it runs about it, and then you combine that with the, in my opinion, the oppression to feelings, how people are not allowed, right, to express their feelings. What can I do to suppress that? Eat, right? Or not eat, because there's so much control, and we all know that eating disorders is not just about food, it's about feelings, and it's about control, right? So it's about controlling our emotions one way or the other. So what a best combination, you know? So we have families that, for example, someone passed away in the family, and you'll see the father saying, let's say the daughter or the wife is crying, no, honey, please don't cry anymore. Please, please give them some food. Bring some cookies for them. Bring them something to eat. So instead of cry, eat, you know, and I've seen it in my private practice. I mean, a lot of them, you know. So and at the same time is what I say, and I explained before, how the person is not necessarily allowed to express their emotions fully, or themselves, their identity. You can't go that way to that place. You can't dress that way. When someone comes, you have to be, if there's, let's say, if there's an extended relative that comes to the house, the younger generation, they have to be there. Mom, I don't want to be there. I just want to be in my room. I have to study. No, you have to be down here, and you have to sit in the living room, and you know. So the pressure lead us to what? What are the things that I can actually control? You know, my eating habits. And so we have the identity that we create sometimes, which is overeating. And so that's the funny, the clown, the sweet, the cute one. Okay. And there's no pressure. I don't even need to have pressure on getting married or no, because I'm the chubby in the house. So the eyes are not on me. Right. And then you have the older one that is underweight, and is the pressure on staying underweight, because that's how the clothes fits you better. People will, you know, so, and it's in both genders, by the way, huh? And it's in and male.
Dr. Hands, I like to connect, if I may, some research, both from the region and from global chronic illness on anxiety, and also some studies we read in international psychology about eating disorders. I'm going to say about eating disorders first. If you remember, there were some work we had to do in international psychology about eating disorders, that eating disorders were known as a cultural disorder of the West. So it started there. But because of the cultural pressures or whatever, first maybe women felt, but then men, and they could even see it in not only heterosexuals but homosexuals. But then I read studies of how the internet, once the internet was created, the places, let's say in Korea, that they didn't have eating disorders, they had access, South Korea, to the internet. In parts of China that did have access to the internet, eating disorders were introduced as a way to cope with distress. So we're from the family of the monkeys, we imitate. So it's like, I have this stress, I don't know what to do, the information comes in, oh, there's a new way to do this. Numbing myself, let's say if some people, let's say, numb themselves with drugs, or numb themselves with sex, or numb themselves with pills or alcohol. And one way is, okay, this is a new way, and it fits, the distress fits what happened. And the other thing was, the more advertisement, for example, of the values of the West was imposed on these countries. Let's say, how should a woman look? How should the body look? How should the eye look? For example, in Asia, sometimes you cannot, it's not part of the gene to have that specific type of the body, that plump or whatever it is, that shape, or the eyes, or the, you know, eyelids. So to what extent can somebody do things, whether it's through, you know, going through that eating disorders or doing surgeries, and that's how they said it started. Is this I want to know your perspective. Is this true? Do you see it as a culture of the West that started to come towards other places, or do you think because maybe research wasn't done and these places, or maybe we didn't have access to it to read it, it was already existed, but it got worse? So
I hope this is a personal question. Yeah, in my opinion, I would say research was not there. Okay, I think it existed. I think it existed. Now, obviously, with the access to media and to other things, it became more of a norm. Okay, so then we are now comparing ourselves with, and of course, keep in mind, again, I'm going to talk from the Gulf mostly. Most of the people from the Gulf will compare themselves with the Western culture. Okay, so then we want to go and study abroad. We want to go and have a job abroad. We want to go and get this shopping abroad. We want to get, actually in Kuwait, I would say, I don't know, Sheikha, please correct me. I would say like 80% of the restaurants that we have here are mostly international chains, you know, like we have every single restaurant that you can imagine in the US, we have it here and more. And so that's the what I would say. It gives them that sense of power in a way, you know. So then of course, why not? That's what they're dressing right there. Those are the jeans. Actually, to find big sizes is quite hard, right? So, or dresses or etc. So yeah, I think that increased, you know, that, but I think it was always there. I don't think there is not one culture to blame for anything. I think
that's correct. And you know, we all know about the power of advertisement. You know, the countries who are the most powerful, their values will be spread. I always think, for example, if Korea was very powerful, we wanted to look more like Koreans. If Kuwait was more powerful in advertisement, we wanted to look, you know, or just like, you know, people in Kuwait, because that's what we are being fed. Thank you for this. I wanted to also mention about, since you talked about anxiety, and this was so interesting because I used the research on and my empowerment work, and also myself having autoimmunity. Once you have, you know, we know there's a rise on chronic global illness, whether it's autoimmunity or other different forms of chronic illness. With autoimmunity, for example, they give you a pill, let's say if it's a thyroid, that, you know, your thyroid is being attacked, but you still have so many symptoms. You can have panic attacks, anxieties, depression, ringing in the ear, and so many other symptoms in your body. And you're taking multiple pills, and, you know, you're getting, well, some things might get better, but then you have so many side effects. So I personally had to go through that. And I always say, you know, I feel I'm getting 2 PhDs at the same time, because the way the medicine was being practiced, it wasn't helping me. Okay. So for, let's say, you know, I had this thyroid issue, I was taking it, but then I was challenged, you know, and I'm going to say this since Sheikha Majda also mentioned panic attacks, anxiety, depression. And then I knew once you start to take depressive medication, it's going to help you to some point, but then it's going to mess up your serotonin pathway. So I knew I had to wean off. And I started to search about, you know, nutrition, nutrient therapy, gut, healing the gut, connection between the axis of gut and brain. And I found my way out. And slowly I told my doctor, you know, please wean me off. At the beginning, actually, they didn't want to give me medication, but I was like, you know, I just can't live inside this body anymore. Help me. So then started to wean off, and I never had those experiences, because as Dr. Mensah never likes to use the word, and his mentor, Dr. Walsh, mental illness, it's the imbalance of the physiology in your body and around your cells or inside your cells. And once you kind of heal that, a lot of times you get help. So that's one thing, a lot of the research that, again, is not being used, whether for physical health or mental health, that I think it can help people on this side of therapy, or maybe after, if somebody is using medication later on, they can change the physiology of their body and slowly wean off of the medication, because later it's not going to work. You just have to increase the doses. The other thing was about generalized anxiety disorder. As you said, it's very correct. I think it's prevalent in the Middle East. So it was, I found this research that was conducted in a university in Isfahan, a very well-known, prestigious university back in Iran. So they did this research and they found out that most women had generalized anxiety disorders compared to men, most women. And they found out one of the reasons.
It's all because of men.
It's culture. It's culture. So, and I think the way we use assertiveness, and then I went on the books of international psychology. Assertiveness is not encouraged in the Middle East. Okay, and the way, so we don't use assertiveness in the way that they use it in the West. The way it's used in the West, if it's used by any of us in our region, it's like aggressive. It's aggressive, it is rude, and nobody is going to even talk to you, and you're going to be excluded. It's like, what type of person is this person is? So our assertive, we use a lot of body language. We have a lot of different ways of doing things, or sometimes because you're the youngest, or you know, the status and everything, sometimes you can't even use it. So these women were so distressed that they can't talk about their needs. They can't put boundaries because they were women, they were younger, just different reasons that held them down the rank of status, whether within their family, their schools, or their working places. It's like, so they used CBT, and they used another technique to teach them about assertiveness. However, again, not the assertiveness that is being used in the West, because what is being used in the West, it's fantastic, and it works here because it works for the culture. I would say in the Middle East, they taught them how to use compassionate assertiveness. I usually, when I use this word for people from the Middle East, they can then accept to be assertive. And I think, again, talking about international psychology, we talk about enlightened globalization. And what it is when something is not working, for example, if we're not encouraged to be assertive and then we're getting more depressed, we're getting more anxious, it's nice to look at the West, let's say, learn from that, and then say, you know what, if I take this skill of assertiveness, bring it to my culture, it's not going to work. So, and we have seen people who something is not working in their culture, they just want to trash everything, use something else from outside, they just go from a hole into a big deep well, or you know, they just get lost, that they create a disaster. We bring that and we say, how can I mold this that it can work within my culture? How can we bring assertiveness in the Middle East that can be acceptable? And again, what I'm reading a lot is, once we need a lot of confirmation first about, I respect you, I love you, I care about you, this is my need. And then again, closing with a lot of compassion. So this is what I'm seeing and what I'm reading, and I want to know your feedback and also Sheikha Majda's feedback about this, you know, connecting culture for what you're seeing, or from the clinical work or entrepreneurial, with the science that I just mentioned.
Well, if I may, I would like to go to the point where Dr. Hands suggested about prior to the pandemic, we have a custom here in Kuwait that even if you are like 30 years old or 40 years old or 50-year-old, male or female, who is unmarried, you have to stay with your parents in the house. And some of them, even if they're married and they have kids, they have to stay with them. So we have these problems of anxiety and depression coming up because of you know, this is the unhealthy relationship that is coming up in this you know, platform. It's not right. Post-pandemic, it became even worse, and that's why the amount of anxiety rose. And I don't want to speak about the domestic violence, because this is something else that we need to trigger, but later on. But we have a bigger problem here in Kuwait because of the social norms. You cannot accept a person, even if he is a man, even if he has his job, he is very well off, he's economically okay, he cannot leave the house. And can you imagine the amount of suffering they get? Because that's what I get all the time. I get reached out because of these problems. And I think, I don't know about you, Dr. Joanne, but the main problems that I have been hearing a lot because of my followers are these problems. They cannot put up with their dad or with their mom, or it's too much, because you have like a very big gap between the two generations. And then this man or woman are like full grown people, and they have their own views, they have their own opinions. So post pandemic, this is the only thing that I saw that that is really sad, because they are suffering. And of course, Dr. Hands would tell you the amount of people who are reaching out for you because of that. Isn't that right, Dr. Hands?
Yes, absolutely, absolutely. I would say that one of the impacts of COVID-19 in this culture and to mental health is the fact that I would say we have a positive and a negative, okay? Just like Sheikha Majda said. Now, whoever had, let's say, a certain level of something, okay? So certain level of anxiety, certain levels of depression, now it feels like it's on steroids, okay? It's like 10 times magnified. And the reason is because now we don't have those distractors to buffet, buffers around. So we don't have the malls, we don't have the food, we don't have the gatherings, we don't have the excuses of like, I have to go to work. And so that's how we escape. Now everyone is there face to face, and we can run away from that, So absolutely, I think that has been probably one of the biggest challenges of COVID in the Middle East, at least in Kuwait, when it comes to their mental health. Some of the things that we tried to perhaps overlooked and avoid before, they are just now right there in front of your face, on the surface. On the other hand, in my personal experience and in my private practice, I have to say that I have not seen like the number of cases that have been coming to therapy now that they never thought that they would. I had a client the other day that as soon as we started the session, he's like, oh my God, I'm sorry, Dr. Joanne, I'm a bit nervous. I never thought I would be speaking to a therapist, so I applaud those, I really say bravo, because it took a pandemic, in order for you to finally take care of yourself, finally understand that you can carry this wave alone, and that it is okay to reach out for help. So maybe it took a pandemic. Well, that's okay, whatever it takes. But so then again, there's a lot of people. We did during the lockdown, we had most of our sessions online through telehealth, and that we had new clients coming to therapy because it was in the comfort of their homes, in their bedrooms. I actually had a client who took my the therapy session, in his closet. He has like a walk-in closet, and he was with his phone in the closet, so nobody could see him or nobody could hear him, but he did it. And so, but that is the type of person that would never walk into my clinic before, just like Sheikha Majda said, before people change, So he or she will not walk into a psychological center, to a therapist office before. Now it's like, that's okay. It helped. I needed it. And so I think that in this region, one of the impacts of the pandemic, I would say it was more of a awareness. Now, I am Sheikha Majda is also part of the one of the advocates for We have a platform called Corona Care Kuwait, which is like a group of therapists, psychologists, and psychiatrists that provide free therapy during the pandemic and during this time of COVID. And it is unbelievable how now, even at a governmental level, we are starting to see that there is no health without mental health. And I remember on our first conference in Dubai, when the Minister of Health said the first opening thing of his speech was, there is no health without mental health. For the Minister of Health to say that, oh my God, that was big, you know? So I think that slowly we are starting to see a change in this region, where is becoming less and less stigmatized. Mm-hmm.
If I can jump in here, this has been just a wonderful conversation, and it's been so good that we've gone a full hour and not even realized how quickly it was going. And so I want to encourage any folks out there who might have questions. I've got one question that's come in so far, and I'm going to ask it in just a second. But if anybody else has any questions that they want to share with our panelists, now's the time to get them in, because our time is starting to get a little short here. And again, I encourage you to use the Q&A tab, type your question in, and we will we'll go ahead and share it with our panelists. But the one question that has come in so far, and we actually got it very early in the conversation, Dr. Hands, when you were talking about the importance of having a community connection of people kind of coming together and supporting this idea of mental health, and how that played such an important role in the development of MIPA and the normalization of mental health in Kuwait, in the Middle East. And so the question that was asked was, does that also translate to how folks are dealing with COVID in the Middle East? Is that kind of collective community work adding to your effectiveness in fighting off the infections there in Kuwait and beyond?
Yeah. I don't know if maybe Sheikha Majda wants to say something about that, but yes, I would say yes, absolutely. Now, interesting enough, most of the numbers of those that have been tested positive with COVID are coming from the Kuwaitis, and it's because of the need for them to gather. Okay, I had a client who told me, plain simple, we were having a couples session, and there was an argument between him and her, and she said, I do not care. Even if I get coronavirus, I need to go out. You know, and so yes, I think that has been an impact. So yeah, the collectivistic society has had an impact on.
I would like to add something, if I may. During the pandemic, we suggested to have a support group, and it was just a conversation between me and my followers. And when I talk about my followers, they come from people who have PhDs and people who are illiterate, like mothers and grandmothers. And we were, you know, I was having a conversation with them, and I was like, you know, I went once in the States, and I saw this support group of, you know, my friend wanted to go to the support group, and I told him I want to go there, and I really loved the amount of discipline, and I told them that this is the society where I want the whole countries to have them the same, because it is such a pure, kind-hearted people who just listen to each other without any judgment. So how about we do it? We started it way earlier, before the pandemic, but it was for special people who had special, you know, who has disorders like depression and anxiety. But that was under the you know, the supervision of psychiatrists and physicians who are, you know, just for them. But during the pandemic, where we are all locked down in our houses and we have no one to speak to, we started this thing called Al-Waha, which is the oasis. And this is something that I'm really proud of. Me with a bunch of doctors and physicians who are specialized in mental health. So we started this Waha, or the oasis, just for people to vent, to speak up, to speak their minds, to say whatever they want to say. If I may say that, I'm very humble to say that sometimes it goes up to 150 participants, and they all participate and speak and raise their hands, and it is very, very beautiful. That's why sometimes I say it's a blessing to have the coronavirus, to have us all trapped at home. It made us more connected.
Sheikha Majda, I wish you start an Instagram also that is in English, because I'm following you in Arabic. I don't understand, but I'm hoping.
She asked me, and I told her, no, her followers are those in Arabic, and that's the target that the audience, that she's trying to reach. And I think it's beautiful, because I think those English speakers, they go to the YouTube videos, they go to different, webinars like this, but those Arabic speakers are the ones that need to hear.
No problem. I'm going to go learn Arabic then.
That's nice.
I'm going to interject here, and I'm going to go between the two of you, because there are many people of Middle Eastern background and heritage here in the States. And for them to also be able to share with family and friends what is being said about their places of origin would be huge. So maybe there can be two sets of posts, one in Arabic and one in English, that you do share on these different sites like Instagram.
ASAP is in English and in Arabic.
Sorry?
ASAP.
Yeah,
you want to talk about
ASAP had, and even me, my posts are I always write it, the captions, I write the Arabic and the translation in English, but while speaking, I cannot speak in English because no one is gonna, understand. I try to have, subtitles sometimes.
Sheikha Majda, maybe that's the next initiative we start, because also people from Iran, they talk Farsi. So, and as Dr. Mensah mentioned, many people from the Middle East, maybe the younger generation don't know either, Arabic, or maybe some of them are not fluent in Farsi, but we can communicate with English. So if you ever do that, it's a pleasure. I would love to work with you on that, definitely.
Yes, definitely. That's our next mission.
We've got another question that's come in, and this is one that I'd actually like Dr. Mensah to weigh in on as well. As we talk about the tremendous amount of stress that people are under during this time of the pandemic, we've got a person asking, is it suggested that we don't make big decisions right now, that the stress caused by this critical situation might make for bad critical decisions?
Actually, Dr. Hands, I'd like you to talk about that.
You can see what I'm saying. Please. I mean, I have clients that are pregnant, about to get a divorce, just got married. So all of the above during the pandemic. And so no, please. You have to wait, because right now, like I said, one of my biggest advice right now for everybody who will listen to this, I know this will be on YouTube, is please, you need to be able to listen to yourself, listen to your body, and be able to understand. I actually like to ask my clients sometimes when I see that they are perhaps confused and not confused, but stopped by a big theme, a myth of something negative, is what do you really want? And go through that question and really analyze that question. And that cannot happen on the spur of the moment. You have to take the time to own that. And I always say, if you want to get married, then you will get married. But I want you to go through the process of what it is, what it's going to be. And you want to have another baby and this is the best time for it. You have to think about it. We don't even know when this pandemic is going to end, what conditions you're going to have, how are going to be your checkups on a monthly basis. So there's a lot of things that we have to be able, and my advice is to please do not make any drastic decision right now. This will pass. This will pass just like everything else, and we will go back to our norm. And even if it doesn't pass completely, we will create our new norm. And then you will be able to make the decisions that you really need to make.
Well, some things that will lead to a higher rate of births approximately 9 months from now tend to happen very spontaneously and perhaps without conscious thought, given the nature of us being huddled together at home. But for people who, I agree with you very much, Dr. Hands, for people who are looking at major life-changing decisions that don't happen on the spur of the moment, it's very important to not jump with the impulse, because these are decisions being made out of stress. And the first thing you need to do, really, this whole process has brought us to a point where self-analysis, whether it's by ourselves or with a therapist online, self-analysis is absolutely key here. What is being shown is that when you don't have the opportunity to go out and distract yourself, when you don't have the capacity to have others distract you, when you don't have all these other pieces that shift your focus from yourself, you have to sit with yourself. And when you sit with yourself, a lot of things start to surface. A lot of things about who you are, where your comfort levels are, where your comfort levels are not. And you have to address really who you are, come to better understanding of who you are. And then if someone else is involved, then the process regarding who that person really is comes into play. And then the process of how you two can navigate these waters or not navigate those waters together come into play. So as you were saying, Dr. Hands, this is actually a very long process. And impulsive decision-making during a time of duress is usually worthy of the idea of a big mistake waiting to happen. So we have to be very, very patient, very cautious, and very self-reflective at this particular point in time. So, Mr. Wells, a quasi-long answer to what really should be a very long question.
Sure.
Mr. Wells, can I ask Dr. Mensah one question? Because our viewers are coming from the Middle East, and maybe they don't know about the work of Dr. Mensah. Dr. Mensah, since Sheikha Majda and Dr. Hands talked about anxiety and depression, would you briefly at least share from your view that is non-medicinal and non-counseling, so people might find who never found help maybe in the counseling or with the medication, or maybe have found some help but not totally, maybe this is a new light for them to approach. If you can kindly share that before we end.
Sure. One of the things that we talk about in the field of orthomolecular medicine is that sometimes anxiety and depressive tendencies don't have an external cause. Sometimes they're not caused by situations. Sometimes they're not caused by family discord or stress from the outside world. So we have many patients, for example, who say, wait a minute, I have the most wonderful life. I have the most wonderful spouse. I have wonderful children. I'm not wanting for anything. I'm financially very, very sound, but I'm not happy. I haven't been happy since, I can't remember. Or I'm anxious all the time for no reason. And so the field of orthomolecular medicine looks at biochemical imbalances or underlying causes within the cellular structure, within the molecular nature of the individual. Because just like any smooth machine, and that's what our bodies really are, some of the most complicated machines ever known in existence, parts can sometimes falter. things can go wrong, processes can go wrong, connections can go wrong. Signals from one nerve to another nerve, from one cell to another cell can go wrong. And when these things happen, the trickle up, not the trickle down, but the trickle up effect from the cellular level, the micromolecular level, all the way through the cognitive and emotional level can be seen as manifesting with anxiety, depression, bipolar disorder, schizophrenia, ADHD, a variety of things that were normally considered to be mental health challenges are actually dysregulations at a cellular level in the brain or the body. I know you've talked about, Maryam, for example, the gut-brain connection and the vagus nerve. And people often talk about the vagus nerve and so forth, but the vagus nerve is a conduit. It's not a cause. It's a conduit. It is a highway by which changes travel that, say, either slow things down or on the other side speed things up, depending whether or not you activate or deactivate vagal input. So what is it saying? There's signals and chemicals that happen in the human system that now affect our nervous system, that now affect our hormones and our neurotransmitters. So the level at which we work is to find out what the underlying molecular causes, the molecular changes that are present that can now lead to these kinds of difficulties. So very simply, one example, it's not, I wouldn't say simple, but one example is the role of copper toxicity. And I want to talk about this because copper toxicity in females, a good 35 to 40% of females globally, not just in the United States, globally, copper toxicity is present, and it can lead to anxiety, to depression, to impulsivity, to agitation, to postpartum depression. Physiologically, you can see signs like endometriosis or fibroid tumors, or endometriosis, or heavy or irregular menstrual cycles, or even histories of breast cancer, or fibroids or ovarian cysts. So when you see these things happening, it's not because there's some external source necessarily. There's an imbalance in the system's ability to get rid of a certain metal, copper. And what's so important about this is that it's so treatable. There are ways to regulate that copper out of the system, and people can now come into balance, which ultimately leads to depression and anxiety, in the worst case scenario, being significantly diminished, significantly. And on average, once you correct the underlying chemical imbalance, people do significantly better. If not, say, my life is totally different. And we've got at least 3 patients who, one has completed her book on the subject because of what she experienced. 2 more have the books in process. So the reason why, thank you, Maryam, you brought this up, is because we also have to address the biochemical or the mechanical side of the human system that can lead to anxiety, depression, and what used to be called mental health challenges. So quite often in psychiatry or even psychology, many times, many of the approaches that we try to use to help people don't always work. They don't always work quite so well as they should in the vast majority of people. And for those exceptional cases, the odds are there's an actual biochemical cause and not a mental cause. And people sit down and say, well, mental health, well, what is mental health? Let's really understand. There's the human brain as a structure, and then there's the functioning of the mind, which is actually more than the sum of the parts of the brain. It is the brain, it is the body, it is the neurotransmitters, it is the immune health cultivated in the GI tract by bacteria and other organisms that secrete their own chemicals that affect how our mind functions. It is an entire macro and microcosm put together. So when we're evaluating this idea of mental health, as Maryam put forth, and thank you, Maryam, there's an entire universe of different arenas that have to be examined depending on how the person responds to one therapy or doesn't respond to a therapy. So in our world, we're looking at how these micromolecular mechanisms, these imbalances, these excesses now lead to anxiety and depression and so forth. So there's a tremendous world in the inner world that we look at. That to me is a wonderful marriage with what Dr. Hands does in terms of looking at the external world and its effects on the internal world. And this is why we've been working so hard and bringing wonderful guests like Dr. Hands, and thank you, Sheikha, and Maryam, bring us all together to explore a multidisciplinary approach to helping individuals. There's no such thing as one size fits all. So this one drug you may take works wonderfully well for you, but it doesn't work for that other person. The CBT, cognitive behavioral therapy, that you engaged in may not work for this other person. And quite fairly, the biochemical imbalance testing that we do for so many people may not work for this other person because it's beyond that. I have one wonderful case I'll just tell you very quickly. We had a young lady working very well with her for a very long time. She was in her 50s, and she had done very well in terms of balancing her chemistry, but she still had gastrointestinal problems. And said that she still, as a result of that, had some anxiety and depression remaining. And after a little bit of time, something came to me, and I said to her, are you bearing any anger or resentment to someone that you've not talked to them about? And she paused and said, yes. I said, who is that person? She said, my brother. She said, I've never forgiven him for how he treated me in childhood. And I said, here is your missing piece. You have to come to terms with that brother and to forgive him and let it go, because it's been festering in you and it's taken over your system and is actually creating much of the gastrointestinal distress that you are engaged in that leads to more of the anxiety and depression. So here's a case where we've got a cognitive dysfunction based upon an emotional dysregulation, interacting with biochemical imbalances, where diet does come into play, but most of all, the spirit of the individual is wounded and it hasn't healed. Here we have 5 disciplines that need to come together to bring this one individual person into completion and restoration. So this is why we have those conversations. And to everyone who isn't familiar with what we do, we're kind of a bridge. That's what we're working towards. We want to bridge the Dr. Hands of the world with the Miriams of the world, with the Mensah Medicals of the world, with the psychiatrists of the world, and come together to have a very multidisciplinary approach to people who are in need. And certainly that doesn't stop here in the United States, nor does it begin here in the United States. It begins all over the world until we're truly all globally connected.
If I can toss in one other point of import here, and that is, since this program is ultimately about coping with COVID, Dr. Mensah, we'd be remiss if we didn't point out the fact that many of our patients who are working with us on nutrient therapy, because much of the nutrient treatment that we offer tends to boost the immune system. A lot of our patients do very well in coping with COVID because a lot of what we do helps them from an immune standpoint as well.
Thank you for bringing that back to being full circle. Where we also see a very important point is that if we are depressed, if we are anxious, if we are emotionally dysregulated, it weakens our immune system. It depletes the very chemicals we need to fight the great COVID fight and any other battle from viruses, bacteria, or illness. Mental illness translates into physical illness sooner or later. And physical illness can indeed weaken our systems to generate mental illness. So when we're talking about what's happening in the Middle East with regard to COVID, when we're talking about what's happening in the Middle East with regard to anxiety, depression, the two ultimately have a relationship. Because as we are weakened by our anxiety and depression, so too we are less able to truly battle the physiological challenges like the COVID-19.
I believe one of them is zinc, the nutrient zinc, that when we're very stressed, we get depleted of it. which is very important to actually, it connects to, let's say, mercury, lead, and the air to protect our brain, heart, and body. But at the same time, a very important nutrient for our serotonin neurotransmitter to be happy and for our dopamine neurotransmitter to have a sense of pleasure. So, for example, copper toxicity, what does it mean? As Dr. Mensah usually does the treatment, one big one is when you're overloaded with copper, your zinc level is very low. But then you need a medical doctor who is trained to bring that zinc level up. So this is just one information, and I think if anybody of the audience would like to know more, there are a lot of videos on YouTube on Mensah Medical. You can go and look and get more informed about it.
Absolutely. Thank you for that, Maryam. We are at 90 minutes, folks, and so we need to go ahead and wrap this up. I want to thank all of our guests for joining us today. This is such an important conversation, and as Dr. Mensah mentioned, part of what we're trying to do is create that bridge, is to create that opportunity for multidisciplinary approaches to helping people. And we just had a comment come in speaking of the lack of resources sometimes for people in the Middle East that don't have the financial means to seek out mental health support, and certainly also the orthomolecular support that we've talked about. And so hopefully part of our bridge building includes creating avenues for helping all people, not just people of means. And so hopefully we'll be able to continue this conversation, not just talking about the pandemic, but talking about continuing to build these bridges. Thank you, Dr. Hands. Thank you, Sheikha Majda. Thank you, Maryam, again, as Dr. Mensah mentioned before, for bringing us all together. And thanks to all of our viewers who have joined us today to listen to this important conversation. We will have this uploaded to YouTube later on this afternoon, and we will post a link to that video on the Mensah Medical Facebook page and on our Twitter account. So please, we encourage you, if you want to go back and revisit some of the things that were discussed today, or if you want to share some of this information with your friends and family, please do check out the Mensah Medical YouTube channel or our other social media sources.
Mr. Wells.
Find a link. Yes, I saw you, Dr. Mensah. You had another point.
First of all, Dr. Hands, you talked about, you and Sheikha Majda have been talking about some of the liberal free work that you've been doing. Do you have a website? Do you have, can we know what your Instagram information is so that we can share this on the video or in our routine interventions when we are sending these messages out?
Sure. Shall I say it? Or shall we write it down later?
Both.
Both? Okay. So we have Dr. Joanne Hands, and we have, what is it? Kuwait Counseling?
Yeah, that's
right?
my private, yes. Mm-hmm.
Yeah, and then Majda JS, and the ASAP Initiative.
Thank you. The reason I brought that up is because I'm quite sure there's someone of Middle Eastern heritage who can't find a Middle Eastern counselor here in the United States that can identify properly. And if they can connect with you, Dr. Hands, or with you, Sheikha Majda, I think that it would be fabulous. So we want to have...
one of the things that Dr. Mensah, you mentioned is that's the beauty of, honestly, the collaboration that we have with Sheikha Majda. That is, she does all these support groups that are coming from people that are also going through the same. So is no shame, it's just pure support, you know? And so I think that even people that are in the US that may need that understanding from another one of their own, you know, someone that is in the same kind of culture, same religion, and going through the same issues. So please extend your, contact us, reach out to us. Mm-hmm.
And we'll Dr. Hands, if I'll reach out to you later today, and we'll get the exact addresses for all those things and make sure that when we do our postings on our Facebook page and the like, that we've got that stuff listed as well, so that folks can find us easily and can find.
And Maryam, thank you for once again connecting the world.
Thank you so much. Thank you
for your generous time and energies. And folks, Maryam is doing this absolutely free because she's a dynamic individual, and this is coming from her heart. She's bringing members of the world together in a very powerful way. Fabulous, fabulous. Thank you so much, Maryam.
Thank you. Thank you so much. It's an honor to, know each one of you and work with you. And I appreciate everybody's time. We're going to make big changes for the better good, hopefully.
We sure will.
Slowly but surely.
Absolutely.
Yeah, Majda, thank you. Take care.
You.
Have a great evening.
Thank you so much.
Thank you to all
Bye-bye.
of our attendees.
Thank you.
Thanks to all of you, and we will see you again next week. Bye-bye now.
Bye-bye.